Hello and welcome to the CIRS Lab Practitioner Monthly Membership, a membership created to improve CIRS treatment outcomes by creating a space where new and experienced providers can interact and learn from the most up-to-date scientific information relevant to CIRS, and by bringing in a nuanced patient perspective on what it takes to heal from CIRS. My name is Christian Navarro Torres, and I'm a PhD cognitive scientist, formerly a postdoctoral researcher at Georgetown and Princeton University, and prior to that, a PhD student at the University of California, Irvine, and at Pennsylvania State University. I'm now fortunate enough to be engaged as a research consultant in the CIRS medical community, including the surviving mold community that is led by Dr. Ritchie Shoemaker. I'm also the co-founder of CIRS Lab, and like many patients, I'm a CIRS patient who has deeply struggled to survive and overcome this illness. At the beginning of 2020, I discovered CIRS right as I was hitting the lowest time in my life, physically, mentally, spiritually, and professionally. During those days, understanding this illness down to the core was the only thing that kept me moving forward so that one day I could return the favor to others in need. And so I lean on to the one thing my brain could spare, the will to live through knowledge and self experimentation, guided by what Dr. Shoemaker had laid out on his published work and interviews. In 2023, my CIRS Lab co founder and I decided to launch an Instagram platform to create a space to educate patients, practitioners, and other broader audiences on CIRS. During this period, I was lucky enough to connect with the CIRS medical community both as a researcher and as a patient. And over time, I realized that there was a great need for creating a space where practitioners could continue developing scientific and critical thinking skills, as well as competency and versatility geared towards a nuanced understanding of CIRS treatment. And the reason for this is that CIRS is at the forefront of systemic change. Practitioners from all over the world are beginning to learn about CIRS, and every year the surviving mold community gets many members certified in the Shoemaker protocol either as practitioners or as proficiency partners. But with that increasing awareness and community growth comes a greater need for ensuring that the nuanced understanding behind the Shoemaker protocol does not get lost. For these reasons, CIRS Lab decided to create the Practitioner Monthly membership with the goal of providing additional support that will act both as a continuing education for experienced practitioners and as an incubator for recently certified members from the Proficiency Partner and or Shoemaker Protocol certification. As such, it is our purpose to bring to you the most updated scientific research and patient-based experiences that will help you achieve the highest possible treatment success to date, while also bringing all the basic elements of an academic setting where we can discuss research and everything science in a manner that is curious but also respectful to the science behind CIRS. I do want to emphasize that this membership is not a replacement for the Surviving Mold Shoemaker Practitioner Certification or the Proficiency Partner. And in fact, we see it as a highly complementary piece. It is meant to serve as part of an ongoing education where you will be exposed to advanced critical and scientific thinking that will inform your clinical practice. And for those of you who are not certified in the Shoemaker protocol, we highly encourage you to become certified to learn all the theory and fundamentals of CIRS and its clinically validated treatment protocol. As far as the membership structure, this membership is going to include the following. First, there will be a monthly live workshop paired with a Q&A and discussion session. These sessions will be recorded to your own benefit, allowing you to go back and revisit any ideas that struck you as valuable. Each workshop is going to focus on a very specific topic, some of which will include high-level advanced information grounded on published research within and outside the Shoemaker community. For example, we will discuss things like what is alpha melanocyte stimulating hormone or MSH, and how does it impact the human body? Why and how does it become impaired in CIRS? And what are the factors that impact MSH recovery the most in CIRS? At the same time, these workshops will also bring practical insights from a patient perspective. So for example, We will cover topics such as teaching patients how to manage their indoor space, how to work with patients who are extremely hyperreactive, how to differentiate prototypical biotoxin patients from those who are also suffering from chronic tick-borne infections. Second, we will be offering a 90-minute monthly group call where practitioners and proficiency partners can come together and informally discuss any ongoing clinical challenges. We will celebrate and learn from success stories and ask questions in an open forum where brainstorming, networking, and exchange of ideas can take place. These group calls will not be recorded, and as such, it will also be a space where we can be open about our own challenges navigating this illness, be it as a patient or as a professional who is committed to helping the most vulnerable. Third, we will be hosting a monthly 90-minute lab meeting call that is very much in the spirit of an academic lab meeting where members present a scientific paper that we can thoroughly discuss together. We can also present and get feedback from preliminary data, ideas for a potential research project, or even just a practice talk in preparation for a conference or a venue. As practitioners, I believe it is very important that you all become familiarized and comfortable with the fundamentals of scientific research, scientific practice, and scientific literacy. Skills such as learning how to read an empirical paper, learning to be critical in a respectful but open manner towards research ideas, learning how to submit papers for publication, how to identify research funding opportunities, how to give a talk that is scientifically appropriate. The best way to integrate these things, in my experience, is by simply participating and becoming an active member of a scientific community. Although these calls will be moderated by me, it is my experience that the best opportunities for learning and growth happen when there is reciprocal exchange of thoughts and ideas. The fourth piece will include what we're calling the Shoemaker Pearls. We are very honored to devote a space for this part called the Shoemaker Pearls. And these will essentially be monthly pre-recorded 2 to 5 minute presentations that will cover advanced selected topics endorsed by Dr. Shoemaker himself. And they may include presenting insights from, for example, Genie, or from less common biotoxin cases such as recluse spider cases. These presentations can be given by active members, by myself, and also outside guests. And finally, I will be producing content in the form of essays and blog posts on specific topics. For example, on the use of prescribed antifungals and CIRS. And this is a space where members can engage in the blog posts by posting comments, questions, and thoughts. So those are the basic pieces of this membership. And with this, I want to close by saying that we're at a critical moment in the history of this illness. And as you already know, our understanding of CIRS is an ongoing, evolving process. We learn new things every year, and along the way, practitioners become better at diagnosing and treating the illness. And CIRS Lab is at the forefront of all these innovations, and we want you to become active members of that process. This membership is meant to evolve over time with new content and new ideas, and that can only happen through your participation in the community. So in that sense, my hope is that together we will build a community informed by science and clinical and patient insights that will become a blueprint for future generations of CIRS practitioners, where they'll be able to take all of your work into new levels. Thank you for joining the CIRS Lab community. If you haven't joined the membership yet, you can do so by clicking the link below.